This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
Hi, Wisconsin. Governor Tony Evers here.
And I'm Lieutenant Governor Mandela Barnes.
We wanted to take a moment today to thank you for wearing a face covering or a mask whenever you are out and about.
Your good work can save lives. As we know, face coverings and masks are effective tools to stop the spread of COVID-19.
That's right. And we wanted to share some tips to make wearing your mask even better. First of all, wear your mask whenever you are indoors in a space that is not your own home.
Second, wear a mask any
on YouTube. A reminder to maintain audio quality. Please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Traci DeSalvo, the Acting Director of the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. And we'll begin this briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us today, folks. Since the beginning of this pandemic, our Main Street businesses have shown their resilience, ingenuity, and commitment to our communities and our workers and our customers. Yesterday, I was proud to announce the winners of the We're All Innovating contest through the Wisconsin Economic Development Corporation that recognizes and promotes the way startups and small businesses are adapting to the challenges of COVID-19. From innovating and helping rapidly test for antibodies like Nova in Milwaukee, to Carrie, who owns Abbey Bar in De Pere, for going above and beyond to keep workers and customers safe, to the Menominee Food Co-op, which created a more robust e-commerce site. Our businesses, time and time again, have risen to the occasion. The stories we've heard have been creative and inspiring, from socially distancing outdoor dining, curbside pickup and delivery options, rotating shifts of workers, and creating pay-it-forward gift cards for families and frontline healthcare workers. So I want to thank all the folks who applied and participated to help us recognize businesses across our state. But we know, despite all their triumphs this year, our Wisconsin businesses are struggling to make ends meet, especially with the winter months coming upon us. That's why last week we announced the third phase of the Wisconsin Economic Development Corporation's We're All In Small Business Grant Program. This round will be targeted at Wisconsin restaurants, with an estimated 95% of their roughly 2,000 businesses receiving funds being a restaurant. All in all, this brings our total investment through the grant program to more than $230 million of our CARES funding, helping nearly 100,000 Wisconsin businesses weather the economic storm created by the pandemic. From our farmers to movie theaters and live venues to the tourism industry and the cultural organizations, we have invested more than $360 million in Wisconsin businesses and economic stabilization for our state. Because we know that our small businesses are the heart of Main Street, Wisconsin, the employers fighting every inch to keep their neighbors employed, especially during these tough times, and the leaders in their communities. Supper clubs and diners, retail and entertainment, they are what give our state character and make it such a great place to live, work, and visit. We will continue to support them every step of the way, but frankly, we can't do it alone. We need the federal government to pass meaningful, comprehensive support, but we also need every Wisconsinite to help do your part to support folks across our state. You can do that by shopping locally. For example, by frequenting local bakeries and coffee shops, buying from local businesses virtually, or by tipping a little extra when you can, but also by staying home when you can, wearing a mask, and practicing social distancing. The bottom line is that the sooner that we get out of this pandemic, the sooner we can all get back to our favorite spots safely. As many individuals and families ramp up their holiday traditions, some may be virtually for the first time, it's important to remember the pandemic has not gone away. Since Saturday, 181 Wisconsinites have died due to COVID-19, bringing our total number of statewide deaths to 3,806. We have surpassed 400,000 cases of COVID-19, and our 7-day average of new daily cases is 3,876. 2 months ago, it was 2,381. 3 months ago, it was 841. More than 280,000 Americans have died from this virus nationwide. Our hospitals are overwhelmed, our healthcare workers exhausted physically, mentally, and emotionally, and so many families and workers and loved ones have made enormous sacrifices for the health and safety of their neighbors. This is a state and national emergency and a state and national tragedy we all share. We all must do what needs to be done to take care of our friends and our neighbors and to look out for the healthcare workers, first responders, and frontline workers who take care of us every single day. I'll now hand things over to Secretary-designee Andrea Palm for her update. Take it away, Andrea.
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again today. Yesterday, we gave you a deep dive into our plans for vaccine distribution, focusing on what we could do to be prepared for their arrival and knowing that we need to adapt moving forward as things change. We'll continue to do these vaccine-specific briefings as we understand how interested and invested Wisconsinites are in helping to end this pandemic. As we move into this next phase, it's important to remember that we must continue practicing preventive measures. The most effective way to stop the spread is to stay home, to avoid interacting with anyone that you do not live with, and to limit your trips to the essentials, like groceries and the pharmacy. With the vaccine on the horizon, we must recommit to the practices we know work. We must also recommit to testing. If you've been exposed to COVID-19, whether or not you have symptoms, please get tested. Call your healthcare provider or go to one of our community testing sites. To find a community testing site in your area, including the address, hours of operation, and other important information, please visit dhs.wisconsin.gov/testing. As you wait for your result, remember to quarantine and call your close contacts. And please, continue to quarantine and monitor for symptoms if you receive a negative result. If you test positive, please isolate, even from the people you live with, to reduce the spread within your household. I mentioned testing because the number of people currently seeking out a test here in Wisconsin is down. The past 7 days, our average daily number of tests is about 29,500. 2 weeks ago, that average was over 39,000. Our current positivity rate remains quite high, which is an indication that we are not testing enough to gain an accurate picture of the prevalence of COVID-19 in Wisconsin. And while knowing that prevalence is helpful to our statewide response, it is critical for the individuals to know if they are positive to make sure they take steps to protect their families and communities. So please, if you need a test, get a test. I'll end with an update on the numbers. So here's where we stand today. We're adding an additional 4,114 new cases to our total today, which brings us to 418,446 COVID cases here in the state of Wisconsin. And as Governor Evers just told you, we have a total of 3,806 Wisconsinites who have lost their lives to the virus. As we keep those who have lost loved ones in our thoughts, we must recommit to doing all that we can to stop the spread and save lives. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality. Please keep your phones on mute until it is time to ask your question. And we'll begin this afternoon with Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, thanks for taking my call. Yesterday we heard a lot about vaccine distribution and the hubs and spoke model, and I'm wondering if anybody can give us a little insight on vaccination or vaccine distribution for some of the more rural areas and how that would work if they're waiting for the vaccine a little bit, or logistically how it works to get them to those hospitals that aren't part of the hub.
Thanks, Danny. So, part of the idea here, particularly for the Pfizer vaccine, is that because it requires that cold storage, that these hubs will be places where that storage can happen, and then the spokes will get it out further to the rest of the state, other parts of the state, and so. Our vaccine registry for folks who want to be vaccinators, including rural healthcare providers and rural hospitals, is open. We are taking those federally required applications. And so hospitals all across the state, healthcare providers all across the state can register through that portal, and then as a spoke to a hub, will receive allocations of vaccine through that distribution system. I do think it's also important, as I know that you all talked about yesterday, the Moderna vaccine doesn't require that same kind of really cold storage. And so as a vaccinator who's registered with the program, that vaccine will ship directly to those healthcare providers per the allocation that we receive, and therefore push down to locals. So a number of ways to make sure that our rural parts of this state receive vaccine, and we are very committed at the state level to ensuring that this vaccine is distributed equitably, irregardless of whether you live in a more densely populated area or a rural part of this state.
Thank you, Danny. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you all very much for the call today. With regard to the 7-day averages and positive cases that we've been seeing over the recent roughly 2 weeks, I was just wondering if you could speak to that a little bit with regard to advice given ahead of the Thanksgiving holiday weekend, asking people to hunker down and avoid gatherings. Does this seem to indicate that those recommendations were followed, or is this more a matter of we're still not to that point of seeing that surge if it is to happen? Thank you.
Yeah. Thanks, Mitchell. I would say broadly, obviously, we are all very happy to see numbers down a little, hospitalizations down a little. But I would ask Traci DeSalvo, if you could weigh in on what this means for trends, and per Mitchell's question, I would appreciate it.
Sure. Thanks, Secretary Plum. I'm happy to talk about this a little bit. So we of course, as Secretary Plum said, are happy to start to see a decrease. But I think it is a little bit too early to say that we have found maybe everyone who might have been sick after Thanksgiving. And we want to make sure that people continue to go and get a test, as Secretary Plum mentioned at the beginning. And I think the other important thing to mention here is, while the number of cases is decreasing, we are still seeing significant numbers of cases, with the 7-day average near 4,000 cases. And you may remember, back in the summer when we reached the 1,000 case per day average, that seemed very high. And so while this is lower than what we were seeing earlier in November, it is still a very large number of cases. And we want to encourage people to continue to get tested and to continue to follow those precautions.
Thank you, Mitchell. Now to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. There's been some concern across the country about some people who may be reluctant to take a vaccine for one reason or another. So I'll ask, this is for everyone on this call right now on the panel, including Governor Evers. Will you take the COVID-19 vaccine when it becomes available? Thank you.
Sure. Absolutely, I will. I'll wait my turn, but when my turn comes up, both my wife and I will get the vaccine.
I will as well. When it's my turn, I will gladly take the COVID-19 vaccine.
Absolutely.
Yep, and I will echo that as well.
Thank you, Rob. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi. With the expiration of the CARES Act funding at the end of this month, I'm wondering what amount of new funding the state needs on January 1st to continue testing and tracing and the other essential components of the state's response to COVID?
Yeah. In our discussion about this over the last few weeks and months, frankly, I think the number that we came up was over $400 million for the first quarter of the year. So just to give you, I don't know if I could tell you exactly what we're going to need on January 1st, but vaccination doesn't happen cheaply. It needs people, and we need to continue contact tracing. Lots of people needing PPE. So our work is not done on January 1st, that's for sure. It will continue on. It'll continue on for a greater part of the next year.
Thank you, Molly. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Thanks for taking my question. This is kind of a follow-up to a question that's already been asked, but since we are seeing, Secretary Palm, you mentioned that testing is down right now, and it's too soon to kind of see how the Thanksgiving holiday might have impacted that. But I know a lot of UW students who went home for Thanksgiving didn't return, and they're doing classes virtually. Do we know if that's playing a role in the drop in testing at all here?
Oh, well, I would say that we are seeing that drop statewide. Whether it is out-of-state students that is having any impact on our statewide testing numbers, I don't know, but it would be hard for me to imagine that cadre of out-of-state students would account for the pretty significant drop that we have seen in testing here in the state of Wisconsin.
Thank you, Tajma. Now to Bruce Marcus from WRJO Radio in Eagle River. Bruce? Again, Bruce Marcus from WRJO. Okay, moving on then to Katie Anderson from WBAY-TV in Green Bay. Katie? Once again, Katie Anderson from WBAY. Okay, moving on to Todd Richmond from the Associated Press. Todd. And a reminder, *6 to unmute your phones. Todd Richmond from the Associated Press.
Hello, can you hear me?
Yes, we can.
Assuming that we get FDA approval of the Pfizer vaccine Friday or maybe Monday or sometime early next week, is there a date certain when we'll see those first doses on the ground here in Wisconsin and they'll be transported to the hubs?
Yeah, Todd, so the approval by the FDA is that first step in starting to be able to get shots in arms, right? After that, the Federal Advisory Committee on Immunization Practices will take that information to provide clinical guidance to providers who will actually be providing those shots, at which the CDC will then distribute to states for training that's necessary for those providers to make sure they know side effects, other important clinical pieces of information that will come with the approval of the vaccine. And then we will obviously start to put shots in arms. We do absolutely anticipate doing that this month, but the cascade that happens post FDA approval will impact the timeline here, as with all other states.
Thank you, Todd. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. The White House last week extended National Guard's deployment for COVID-19 testing efforts into next year. Can you talk a little bit about what the state's going to have to do to support the Guard in its community testing? Thank you.
So we were obviously very pleased to get that extension for the use of National Guard. There is a cost share for their continued deployment. I think, but we will confirm, Sean, that it's a 75-25 split. But we are very pleased to be able to continue to have access to those volunteers so that we, as part of our planning for 2021 and knowing that we will need to keep testing, to have access to that really important resource.
Thank you, Sean. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina.
Hi there. So my question is for the governor. Governor Evers, what is your response to the Texas Attorney General suing Wisconsin over the election and claiming that local officials are the ones who made it fraudulent? And how will the state be responding to this?
I'm sorry, did you say the Texas Attorney General?
Yeah.
No, good. Yeah, think of the irony here. We have a Texas Attorney General who's being investigated by the FBI for various improprieties. Numerous newspapers in Texas calling for his resignation, and he teams up with President Trump to try to take away the votes of the people of Wisconsin. I mean, it's irony, but it's not funny irony. It's extraordinarily sad. You think about all the issues that we're facing as a state, whether it's a pandemic. I was with a group today talking about homelessness in the state and how with the cold weather, this is going to be an extraordinarily difficult winter with nonprofits not being able to raise money because of the pandemic, because people that volunteer in these homeless shelters, fearful of getting COVID-19 and not being able to open shelters for people all across the state. And then we have this happen, and we have to focus our energy because some person that's being federally investigated in Texas is trying to take away the votes of the people of Wisconsin. I just think it's outrageous. It'd be funny if we didn't have all these other things going on, but it's just outrageous. The president shouldn't be hanging out with people like this.
Thank you, Katrina. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
New data came out today about AstraZeneca's COVID-19 vaccine, showing that it's 70% effective, and that's compared to more than 90% efficacy for both Pfizer and Moderna's vaccines. So my question is, will vaccine recipients, once all of these vaccines are eventually approved, be able to choose which vaccine they want? And why would people be okay with receiving a vaccine that's 70% effective when there's one on the market that's 95% effective? Thank you.
I will admit to not having seen the company's release of that information. Traci, do you have any visibility on that?
No, I don't yet today. Sorry, Secretary Palm.
I mean, I think more broadly speaking, there are 4 or 5, maybe 6 candidates in development. I think a number of them could reach the finish line. AstraZeneca may be included in those early in 2021. We need as many tools in our toolbox as we can, considering that Moderna and Pfizer, should they be approved here in the next couple of weeks, will not be able to meet the demand here in the U.S., in Wisconsin, or worldwide for a vaccine that is necessary. So I think we'll need to see how AstraZeneca and other candidates move through this process, what the actual data shows once they submit to FDA. But we need all of these candidates to continue with their clinical trials, to continue making progress so that we have as many tools as possible to fight this pandemic.
Thank you, Madeline. Now to Sierra Whaley from WJFW-TV in Rhinelander. Sierra? Again, Sierra Whaley from WJFW. Okay, we're moving on then to Stephanie Hoff from WIS Politics. Stephanie?
Good afternoon, and thanks for taking my call today. My question is for the governor. What can you tell us about your meeting yesterday with the Speaker and the incoming Senate Majority Leader? Is there any progress on a bill being done before the year ends?
Well, we're still working on it. We had a good conversation with both Speaker Voss and Majority Leader-elect Lemieux, Senator Lemieux, and so we're looking to find common ground every place we can, and we're continuing to do that. Obviously, one of the issues that's facing us is even though the senator is doing a great job in participating in these meetings, the majority leader is not Senator Lemieux, but Senator Fitzgerald is pretty much nixed the idea of meeting in December before the end of the calendar year, which in and of itself is a problem. But we continue to have a good conversation, and hopefully we'll reach a good conclusion.
Thank you, Stephanie. Now to Dan Malloy from Spectrum News. Dan?
Hi, this question is for Secretary Palm. Does the department have a number or a percentage of Wisconsinites that, should they get vaccinated, would really do a dent into this pandemic? And more broadly, how will the department judge the effectiveness of this vaccination distribution campaign? Thank you.
Mm-hmm. Thanks. I don't know yet if we know what the percentage of the population that would need to reach herd immunity, which is what I think you're asking. But I would, Traci, do you have a sense if we know that yet? My sense is that we don't. But
Secretary Palm, you're right. We don't yet know what that percentage would be that we would need to reach herd immunity. And so what we're going to do is continue to encourage people who are eligible as those different phases of vaccine come out to get vaccinated. And CDC and other organizations will continue to look at what is needed to reach those herd immunity levels. And those targets will be set in the future as we continue to collect more data.
Thank you, Dan. Now to Emily Davies from WSAW-TV in Wausau. Emily?
Hi, thanks for taking my question. My question is for Secretary Palm as well. Speaking of just getting the second dose for some of these vaccines that require it, there are some people saying, including a biologist at Penn State University, saying that if people only get one dose of the vaccine, it could cause mutations with COVID and then make that strain resistant to the vaccines. So I guess, one, have you heard of anything about that and the importance of getting those second doses? And then two, what is Wisconsin doing to make sure that people do get that second dose if that strain is required?
Yeah. I mean, I should be very clear. I am not a immunologist or a vaccinologist. I'm not familiar with the comments that you referenced from this biologist. I will tell you that there is a reason why these vaccinations are 2 doses, and that is because they provide the most protection when you take both doses. And so obviously we want people to be protected. We want them to be as protected as they can be, and therefore we will absolutely encourage folks to take both doses of that vaccine. It is part of what makes this vaccine campaign so unbelievably unprecedented as a public health endeavor, because what we know so far about the 2 candidates that are close to crossing the FDA finish line here is that one requires the second dose after 21 days, the other requires the second dose after 28 days, and it will be potentially different for other candidates that cross the finish line. So our technology backbone to help track vaccinations is a critical piece of our ability to make sure that everyone is reminded that they need their second dose and which dose that is. Because, right, you need your second dose to match the manufacturer of your first dose. And so all of that preparation, all of that planning, all of that work is underway. Wisconsin has a robust immunization registry that the department has managed and maintained for a number of years here in Wisconsin, and it is connected to our health records, to our individual health records with our providers across the state. And so we will be able to tell individuals can look it up themselves in the immunization registry. So you yourself can track which vaccine you got on what day, and therefore calculate when your next dose will be. So together we will all need to make sure that everybody gets their second dose when it is time for them to, and our allocations from the feds will account for everybody's second dose, so that we will have access to not only first doses for everyone, but second doses for everyone.
Thank you, Emily. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie?
Hi there. Thanks for taking my call. Going back a little bit to the conversation about testing being down and overall numbers being down.
Did we lose you, Sophie?
Hello, I'm sorry if I lost you there. Testing being down. Could you explain why you believe testing is down at the moment?
It's interesting, Sophie. It's we're all sort of scratching our heads about it, considering the high level of new daily cases that we continue to see. Right, often that motivates people to get tested because they understand the intense community spread, the prevalence in communities. They understand that they've been potentially in contact with positive cases, or they know that they've been in contact with positive cases. And so it's not entirely clear to us what is in the minds of 5.8 million Wisconsinites that has reduced those seeking testing on a daily basis. We know from conversations with our colleagues around the country that there are some states who, similarly to us, are seeing a decline. We know that there are some states who saw a lag coming out of the Thanksgiving holiday, but have returned to their pre-Thanksgiving levels. And we know that there are some places in the country that are above where they were pre-Thanksgiving. So it is why we wanted today to take the opportunity to encourage folks to get tested should they need a test, because it is an important part of our strategy. We have the capacity to do these tests. And so if you need a test, please get a test and then do the appropriate quarantining and isolation depending on the result you receive.
Thank you, Sophie. Now to Nick Bohr from WISN TV in Milwaukee. Nick?
Good afternoon. My question, I think, is something a lot of people are wondering, that based on your models for vaccinations, what's your best projection for when life can get back to normal in Wisconsin?
Yeah, you're right. It's the $64 million question. I think I think some of this, right, really does depend on how many vaccine candidates make it across the finish line, in what time frame, and what is their manufacturing capacity, right? That pushing that through those doses through the system in some ways are the rate limiting factors to what you can put in arms, how many vaccines you can put in arms. And so some of that information we know, some of it we don't know, some of it is dependent on the contracts that the feds have already signed with vaccine manufacturers, others that they will need to sign in the future. And so it really is hard to express how long it will take to vaccinate enough folks to really get to a place where we can get back to normal. I think our best guess is in the late summer, fall timeframe. But again, that will change and evolve as we learn and understand more about the number of vaccines that are at our disposal, when they're coming online, and how many of them will be made available to America and those of us at the state level.
Thank you, Nick. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thanks for taking my question. This is a pretty basic question, honestly. We're getting questions from people about the timeline of the vaccine, and some people just don't understand, I guess, why members of the public won't be able to get the vaccine right away. And I guess, can you speak to sort of, the supply and demand issues that we're seeing here with us, with Wisconsin and across the country? And I guess also along with that, which high-risk people would be getting the vaccine first?
Yeah, so I think sort of more broadly, for context, I think one of the things that we need to remember about this pandemic, this disease, this vaccine, is that it has been developed at a rapid clip, and the federal government, for the first time ever, to their credit, prepaid and has had pre-manufactured millions of doses of this vaccine. And so this is a totally different scenario than we normally see medications, vaccines, treatments come into the marketplace for the treatment of diseases. And it makes sense considering the urgency of this crisis, the daily infections and deaths that we're seeing here in Wisconsin and around the country. But this is very uncharacteristic for the way treatments and the distribution and the manufacturing of medications is normally done. But it's also consistent and the same in that a Pfizer or a Moderna or an AstraZeneca or name your company has a finite amount of manufacturing space for the products that they produce. And so through its contracts, either with the federal government, with providers, it's taking orders, it's scaling up production, but they have to get raw materials to make the product. It's all of those normal manufacturing issues that you face with a medication or a treatment or a vaccine normally, but there is a sole focus on COVID-19 vaccine like no other treatment we have ever seen before. So it is not uncommon for treatments, once they are approved by the FDA, to take time to scale up, just by the very nature of what it means for that company to purchase, to get in line, to expand its capacity to manufacture, et cetera, to start pushing product out the door. And again, the difference here is that the feds guaranteed some amount of purchase of that product. Otherwise, those companies would not start that process. They wouldn't invest that kind of money until it was actually approved by the FDA. So it is very different, but similar in that you still have a finite amount of manufacturing capacity that these companies will use to push it through their systems and out to states to use in the arms of our citizens. I think when you think about its availability to the general public and the tiering, the thing that people need to understand about whether it's the Advisory Committee on Immunization Practices or our State Disaster Advisory Committee here in Wisconsin, they are looking at how you prioritize putting those shots in arms in a way that reduces, to the greatest extent possible, illness and death, and along with those who are most likely to be exposed to COVID-19, right? So that's how you get healthcare workers who you need, who are exposed on a daily basis, who need to be able to continue to do their jobs, to keep the rest of us as healthy and safe as possible, and it cascades from there, right? Those in skilled nursing facilities, because they are most likely to suffer severe illness and death. We have seen that throughout this pandemic, and right. So that is how these expert advisory committees take in information about how to guide us in terms of prioritizing vaccine. It's about exposure, about susceptibility to severe illness and death, and reducing that to the extent possible. And yet, right, that overlays with the fact that it's a scarce resource that's going to ramp up over time. And so how you meter reducing illness and death as much as possible with reaching those of us who are healthy and middle-aged, who are going to be last in line. That's sort of the trick of these advisory committees, and we appreciate their expertise. We appreciate that it's not an easy task, and we look forward to their recommendations.
Thank you, Rose. Now to Taryn Powell from Milwaukee Public Radio. Taryn? Again, Taryn Powell?
I don't have any questions at this time.
All right, thank you.
Can you hear me?
Yes, we can. We'll pass on you then and go to Steve Elbow from the Cap Times. Steve?
My question's been covered. Thanks.
Okay, thank you, Steve. Now to Eric Gunn from the Wisconsin Examiner. Eric?
Hi, you've spoken about the importance of renewing some of the sources of funds for things like contact tracing and testing and so on that comes from the CARES Act that expires at the end of the year. A question for you is, what sources will the state be able to tap in the event that there is not an immediate renewal of that kind of funding from the federal government? And are those sources ones that the administration can simply access directly, or are there ones that will need legislative input and approval in order to get access to? Thank you.
Yeah, I guess I answer that in both ways. One is there are funds that are available to us, parts of our budget that we can, under severe circumstances, continue to use. In turn, we can, as you may have seen in some of the suggestions from Republicans, that they're going through Joint Finance Committee to access some funds is also a possibility. But either way, the lack of effort on the part of the federal government to do their fair share, we will get this done here in Wisconsin.
Thank you, Eric. Now to Rebecca Clough from WTMJ in Milwaukee. Rebecca. WTMJ. Okay, moving on then to Christina Lefring from Up North News. Christina.
Thank you. My question has been answered.
Okay, thank you, Christina. Now to Anne-Marie Hilton from the Sheboygan Press. Anne-Marie. Once again, Anne-Marie Hilton. Okay, moving on to Brad Mallory or Lane Kimball from News 3 Now, WISC in Madison. Brad, or Brady, I'm sorry. Okay, moving on then to Hope Kerwin from Wisconsin Public Radio. Hope.
Several state legislators from the Kenosha area say that state law will need to be changed to allow Pfizer to distribute their vaccine from Wisconsin to other states. I'm wondering if this is something that DHS is looking at or the governor's office is looking at as a needed change.
It's my understanding that the issue is not about, to your point, distributing vaccine within the state of Wisconsin. It's about distributing it from here to other states. And that it's not about the vaccine, but about an administrative kit, a kit that would go with the dose that would not be manufactured by Pfizer that would require an alteration to accommodate that, and that's not something that we are likely to see yet in 2020, but could become an issue in 2021.
Thank you, Hope. Now to Martin Roccatsoli from WORT Radio in Madison. Martin?
Governor Evers, how do you feel about Republican lawmakers putting up a Christmas tree in the state capitol?
Isn't that something? They go 230 days without doing any work legislatively, which I think is their job, and then spending short period of time putting up a tree in the rotunda in a building that no one's in, or very few people are in. So the reason we didn't put one up this year is the Capitol building is closed because of COVID-19, and we want to keep people safe, and therefore we did not put a tree up in the rotunda. We did put 4 trees up around the outside of the Capitol, as per usual, and have several outdoor displays at the executive residence. But there's a bit of irony there, too, that can't come to work to pass any bills around COVID-19, but by golly, we'll come in there and put a tree up when no one's looking, and especially after they didn't get approval from the one committee that controls that. And so just weird.
Thank you, Martin. And our final question this afternoon belongs to WAOW-TV in Wausau. WAOW-TV? And with that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.